Dr. Girish Rao is a faciomaxillary surgeon, professor, and a specialist in reconstructive facial surgery. In his 22-year-long career, he has performed over 10,000 surgeries, at least 2,000 of which have been done free of cost for those who needed reconstructive surgery and could not afford it. Dr. Rao has treated issues ranging from clefts to bullet wounds and performed a variety of aesthetic surgeries for those undergoing treatment for oral cancer.
I mean, when we were training 25 years back, at that point of time, it was all dental work what we were doing. You know, as faciomaxillary surgeons, we would wire the teeth together or maximum take out some wisdom teeth, or if you had a jaw tumor, we were just resecting the tumors. Today, what has happened is, a lot of youngsters went out of the country, we trained, and then we came back to give this thing, the kind of facilities to our patients. And that's where there has been a sea of change. So whenever we are dealing with some kind of tumors, we are now reconstructing every time. When we are talking about trauma, we are putting back the bones in such a way that straight away the patients are able to function from the day one. So if you have a trauma patient walking into a practice, we used to wire them up for about 6 to 8 weeks in the past, not give them any solid foods. Today, I don't remember doing any of these kind of things for the last 20 years. So there has been a huge change in the way in which things have happened. And that's where cutting edge technology, which has come in with the level of expertise, with an affordable cost, in India, we are really on top of the world.
Natarajan Ramachandran is a recent patient of Dr. Rao. An Indian living and working in Nairobi in Kenya, Natarajan was one of the victims of the fateful militant attack at the Westgate shopping center, an attack that resulted in 65 deaths. Natarajan was shot in the neck on the 21st of September.
So I was in the supermarket shopping, and then business was as usual, so I finished my checkout and came out. I was pulling my trolley and suddenly the gunshots started coming out and people screaming left, right and center, running panically, because by then he already shot the main security, there was lady security, couple of other people, everybody is lying dead in front of my eyes. Then the moment I saw him coming back, I closed my eyes and I was lying, like this, thinking that he will leave me, that I am dead, just walk away. No, but he shot me still. My eyes went blank for about 30 seconds. Left eye became completely black, and the ears were, no sound was coming. But after 30 seconds, I became normal. But by then, I was lying in a pool of blood, and I couldn't lift my left hand.
A bullet actually went through his neck, and this was the entry point there, and then it actually came out of the cheek. And when it went through those whole tissues, through the face and neck, it actually fractured the jaw. He was so lucky that it missed the cervical spine, that's the spinal cord, by just about a millimeter, or the big vessels in the neck, that's the carotid or the internal jugular vein. Had that happened, then he would have been paralyzed if the spine was injured, or if the big vessels were injured, then he would have basically bled to death or whatever it is.
After initial care in Nairobi that failed to address Natarajan's complex injury, his family contacted Dr. Rao in Bangalore, India.
I was in pain, so that is where I told my wife. My wife was anyway there, my daughter was also there. I said that let's move back to India and get it done.
The moment he landed up here, after doing a proper clinical assessment, seeing the degree of injury, we generally get in for some investigations. And the most common investigation which we ask for is either a CT or an MRI. And in this case, we had to do both because the injury was very close to the cervical spine. I had to get an MRI scan of the cervical spine to see if there was any damage to that structure. And then the CT scan of the facial bones also to see the extent of injury. This is the CT scan of Mr. Ramachandran. And you can see the lower jaw here where the bullet actually pierced through the lower jaw. I can also show you a close-up of this wherein you can see this over here. The bullet has just completely shattered this bone into multiple pieces here. One fracture goes here and the other goes here, and also a fracture of the upper jaw too. So once we do the CT scans, then we do his medical evaluation. So we do a battery of blood tests, and once that is done, we get him to see the neurosurgeon and my other physician to make sure that he's okay with, to go for the surgery. Then we subjected him for this surgery, and it had to be done immediately. So I did that the very following day, wherein he underwent a major operation. This was about 2.5 hour surgery.
The moment I came out of the OT, I mean, when I gained my conscious after this anesthesia effect was over, next day itself my appetite started coming back. So I wanted to start off my, otherwise for 21 days it was a big trauma. I was not eating and it was extremely bad. So everything, it was a fantastic experience. There was no issues at all. I mean, everything fall in place.
This is the post-operative X-ray after his surgery, and here you can see the fracture here, which has been plated with these tiny microplates made of titanium. This is the one which has actually stabilized the bone, and he's now able to open and close normally and chew normally.
I'm getting along very well now, and follow-on checkup, everything went on well. So I'm looking forward to go back on 13th.
To be honest, I'm passionate about facial surgery, and for me, I would like to give back something to our society. I mean, I was in a very good position in England when I was training in England, and then I had a fantastic job in London. But I wanted to come back because I wanted to do something for India. And that's where I decided to come back to my hometown, that's Bangalore, and establish a center of excellence in Bangalore. And that's what I've done today. And today we're getting a lot of people from all over the world coming in and looking for our center and the level of care which I'm giving. And that is very, very rewarding. And that is something, a social responsibility. Cost should never be the major criteria. And every patient is entitled for that quality of care. And that's what I'm looking at doing, and that's what I'm doing for this country.
Hope you liked that story of progress. Keep ahead. Subscribe.